Today we're going to talk about body dysmorphic syndrome and when to operate and when not to. Dr. Rios?
Well, I think, probably all of us have been caught up with a patient that may have this. And what this is a patient who may really focus in on a defect on their face or their body. And when they're talking to you, you're not quite seeing it, and you're having them to explain it to you. And maybe they're kind of doing that, I don't like my nose like this, and they can't really specifically point. It should be a clue that that person may be going through this, but really kind of obsessive, compulsive about some particular part of their body that's really hard to recognize, yeah.
For me, the radar is if something really doesn't look that bad and a patient is devastated, it's impacting their life. I mean, you realize there's something going on, and then sometimes you can look at other hints. Are they on Adderall? How often are they working out? Is it almost, something that everything is going to an extreme? And you really have to take that patient into consideration and make sure that they realize that one procedure we do, that we're actually focusing on the area that they're concerned about, that it may not change their whole life.
I think you brought up a very important point when you said affecting their life, interfering with their functioning socially. Dr. Rios, could you comment further on that?
Yeah, so I think all of us probably have something we don't like about ourselves, but that doesn't stop us from going to work and doing a good job. This kind of starts bleeding into other aspects of their life. So then they start avoiding people. Maybe they change their clothes all the time, or they're changing their hair or appearance and makeup, and then they're just avoiding maybe going to work, avoiding being out socially, and so it really starts creeping into other aspects of their life. So it's not just, hey, I don't like this little bump on my nose. Like you said, they're devastated almost by this defect, and then it takes on more than, are we really going to fix that by just working on a part of their body?
And it's our job as plastic surgeons to be able to recognize that and understand that, because if you've seen in the news the headlines, celebrities and patient or women who are beautiful, like Megan Fox just said she struggles with body dysmorphia, and that's someone you would look at and say, what is there to worry about on you? But we need to see the signs and recognize it and know when to say, hey, maybe surgery is not the right thing right now.
What about the patient who comes in and they've seen 6 others of your colleagues, all competent surgeons, and it just seems that no one can fix this problem, but that patient is banking that you can be the one doctor who can perform that miracle?
Yeah, now with social media, they'll tell you, I've seen all your videos and I know you're the one that's going to be able to do. It should be a clue. It should just be a clue. And if they've gone to some of your, trusted colleagues and they, why do you think you're going to be able to do it? So that should really be a clue.
Sit down and say, I'm a physician and I'm concerned for your mental health, or to say there's a reason that everyone is saying no, and let me show you why, and let me show you why that would be money horribly spent and you would be devastated after. If you're upset now, think about if this is not fixed or made worse. But we have to have those honest conversations. And you know what? Patients are usually very appreciative when they sense we're being honest, even if we're not telling them what they want to hear, but we're explaining why we're saying no and not just shutting the door.
For more information on plastic surgery, please go to theplasticsurgerychannel.com.